Chair lays out House Bill 321 and calls Representative Howard to explain the bill.
Thank you, Chairman Meyer, Vice Chairwoman Theory, and committee members for the opportunity to present this bill. House Bill 321 is quite simple. It exempts menstrual products like pads and tampons from the state's sales and use tax. Every month, approximately 5.6 million Texans between the ages of 15 and 50 have a period. As they bleed for about 1 week every month, these Texans go to work, they go to school, they take care of their families, and they must buy menstrual products. To put it simply, menstrual products are necessary in order to participate in today's society. You cannot simply ignore your period. Yet despite their necessity and the fact that other health-related items are exempt, menstrual products are not exempt from the sales and use tax. HB 321 recognizes the importance of period equity for menstruating Texans by exempting these products from the state sales tax. Now, I really want you to understand the impact this bill would have on women and menstruating Texans. Most, if not all, agree that period products are a basic necessity of life. Yet 1 in 4 Texas women regularly struggle to purchase period products, and 1 in 5 girls report missing school monthly because they do not have access to period products. Period poverty is real, and it harms Texans who are unable to afford period products. Women who are unable to afford these products will often use makeshift products like socks and tissues. But according to the American Medical Association, these practices can have serious health impacts, resulting in vaginal and urinary tract infections, severe reproductive health conditions, and even toxic shock syndrome. The convergence of poverty, the cost of menstrual products, and their necessity mean that millions of our constituents are struggling each month to find the money to pay for medically essential supplies. Now, obviously, this bill does not solve period poverty, but it is past time that we give tampons the same sales tax exemption products that we provide for all other medically necessary goods, such as soap, sunscreen, and dandruff shampoo. 20 other states have acknowledged these facts and eliminated their period tax. More are set to do so this year. Most recently, Florida, Ohio, and Utah have all repealed the tax. Texas now has the opportunity to join these states and relieve some of the tax burden on our Texas families. And with 77% of Texans supportive of repealing the tax, this is a win for all Texas. Now, this is not the first time that I have come before some of you to advocate for this measure, but I'm hoping today will be the last time. Each time I've stood before you, it's been with bipartisan support for this bill. My friends on both sides of the aisle recognize that it's time to put more money back in the pockets of hardworking Texas women and their families and eliminate this sales tax, which disproportionately harms women and girls. I will mention the fiscal note that you might be seeing there. I'm on appropriations. I spend money. Y'all are on Ways and Means. You find us some revenue. So I get the dilemma. Believe me, I get it. In the greater scheme of things, we're not talking about a huge amount relative to a lot of the things that are, if you look at the tax incidence reports about things that are we do exempt already, that have large tickets to them. I just want to say, and there's somebody here, I think, from the Comptroller's office that can provide clarity if we need it, but we've had some fluctuating fiscal notes over the years that we've been looking at this. And most recently in California, where they were able to implement it, they found that their fiscal note was actually reduced significantly when it was actually implemented, and they saw that the impact was not as large as they had anticipated. Our assumptions, of course, are important here, and we need to look at that. But really, I think what I want you to look at here is obviously you have to look at the fiscal note. But in the greater scheme of things, we're talking about fairness. We're talking about something that is a tax on a medical necessity that is required by every single woman and girl in this state between X number of ages for 30 to 40 years of their lives every month, except for when they might be pregnant. Have a little reprieve there. This affects families because girls and women are a part of the families. So it really affects all of us. And I think you're going to have some testimony today from some very engaged young women that have found this to be a very important issue for them. Some of them are already of voting age, some are not. But they see this in front of them as an equity issue. And they're here because they want to participate in government. And I have asked these young women that are here to please come up and testify, to also recognize that we want to be cognizant of time, and they're well aware of that, and they want to come say their piece, but they also recognize that they can agree with others that have spoken without having to repeat everything. But I want us as a body to feel very proud of the fact that we have these young people that are engaged enough to come and travel across the state even to talk about a bill that means something to them. And what better way do we have civic engagement than to have something that's of relevance to these young people? And hopefully they will continue to be connected to this civic process. So I appreciate the opportunity to bring this before you today. I appreciate your willingness to be attentive to these young women who are here to talk with us, their legislators, about their concerns here and what they want to see us do. I'm happy to answer any questions, and I reserve the right to close.
Thank you, Representative. Members, any questions?
Chairman.
Yes, Chair recognizes Representative Cole.
Representative Howard, can you give us a definition of what is considered health-related costs?
Sure. Yeah, we've got a list of, if I can find it here real quick, a list of all kinds of things that already are exempt from sales and use taxes here. I'll just tell you, a whole lot of over-the-counter medications, obviously prescription medications, that sort of thing. But, you know, anything that you would get over the counter, Band-Aids, antihistamines, hemorrhage medicine.
So is that medically necessary? Is that included?
Well, and that's a good question for the comptroller's office when if you want them to come to tell you exactly how that definition is arrived at. I can tell you that at a previous session when I was looking at the tax exempt status of condoms, they were once tax exempt and then no longer were, and it had to do with the medication that was used with condoms and then FDA recognition of this medication. So there are certain guidelines. I can't give you the exact nature of what that is, but they do have things that they look at. Certainly, I can't imagine any definition that would not include menstrual products
As medically necessary.
as anything other than medically necessary.
Yeah.
You must have them, and as I pointed out, the AMA has indicated if you don't use these properly, and unfortunately, people who are challenged resource-wise use pads for too long, and certainly even more critical, tampons for too long. And that's where you end up having medical conditions because they have been used way past their time, and it becomes unhealthy.
To maintain costs or to cut down on costs.
Yes.
Okay, thank you.
You're welcome.
Thank you. Members, any other questions? Yes, Chair recognizes Vice Chair Theory.
Thank you, Chairman. Thank you, Representative Howard, for bringing this bill.
Sure.
I remember last session when you did, and, you know, I remember when I first heard about it, I wasn't even aware that all these years, you know, I guess as a woman, you just take it for granted. You're just paying a tax on something. I wasn't aware that there were so many products that are not taxed. So I wanted to just answer Representative Cole's question. There is an exemption here on the Comptroller Texas.gov site for wound care. And so all adhesive bandages are exempt. So that's any type of a Band-Aid or any type of a strip to cover bleeding. Gauze, liquid bandage products, medical tape. Now what's really interesting in here is corn cushions are actually exempt. Like if you have a corn on your toe and you just want to put a little cushion on your toe to protect the corn on your foot, that's actually exempt. And so it really is mind-boggling to me, but obviously this isn't, budget night's coming up. I don't know if people would say, well, we got to do a put and take. You take from something and put
Right.
something else on this for the fiscal note, but there's certainly some items that probably shouldn't be on the list that are on the list. So I just wanted to kind of get that in the record, that I didn't know that there were so many other items that are on the list that I would think would be that this would be just as important. And then the second point I wanted to make is just from a definition standpoint. Clearly, these are medically necessary. No one would use them otherwise. There's no occasion to use them otherwise. But from what I understand, they're actually being considered as a luxury item. So I would hope that maybe there's some members that could speak to that later, and we can look at that, and that may be part of the analysis in moving us forward to get the support for this bill. Because if there is a misunderstanding in anyone's mind that it is a luxury item, a luxury necessity, then maybe that's part of the conversation we need to have. Maybe awkward in and of itself, but we're all, grown women and men here. Because I just would go on the record to say there's nothing luxurious about
Nothing.
it. And so I hope I would get the support from some other colleagues that would agree with that. So I just wanted to say that part on the record for it.
Thank you, Representative Theory. Clearly, the decisions we make here about what to exempt, there are decisions that are made for a certain reason, a certain constituency, whatever. And those are choices we make. I mean, I have been schooled over the years from people like Dick Levine and Dale Kramer, who may be here today too, about the fact that, every time you make an exemption, it's appeasing some group. And it's hard to take that back once you've done that. And in a pure world, I guess the Tax Foundation has said we shouldn't be exempting anything. We just exempt everything at a lower rate. And that way we don't have these issues. But then we get into the regressivity issue and the fact that those on limited incomes need food and medicine, and that they should not be penalized for that. So I don't think there's any real magic, wonderful answer here. But the bottom line for me, and looking at this over the years now, and talking with young women and older women and families and my Republican colleagues, is that this is about equity. This is about recognizing that this impacts women disproportionately, and not to be using this in a threatening way, but there have been class action lawsuits in other states as a result of this, which has, the lawsuits have been lifted when these sales tax exemptions were put in place. So that's a real thing out there to think about. It's not something that I'm bringing to you, though. It wasn't in my layout here. But certainly I think that we have decisions to make here. We can decide to do something that's equitable, or we can just push this aside again and go ahead and keep sales tax exemptions on dandruff shampoo and Band-Aids, but not look at menstrual supplies.
I have one last question, Mr. Chair.
Please.
When you say, I think it's even accurate to say, I get your point when you say it impacts women disproportionately, but it's even fair to say it impacts women only. Only. It's not like disproportionate.
Well, that's a very good point.
Yeah, it only impacts women. It's a 100% an issue that, a financial issue for women, that women are being taxed on. And not men. So I think it's
That's
even
true.
more accurate to say it's not disproportionate. It is only a tax on women.
I accept your clarification.
Thank you, ma'am.
Thank you.
Chair recognizes Chair Button.
Thank you.
Married filing jointly, I pay the tax.
Men are in families that pay taxes.
Married file jointly,
File jointly, yes, thank you.
Thank you, Mr. Chairman. Representative, let me first thank you for bringing this to my attention, and I'm proud to be your joint
And I
author.
thank you.
And actually, what you mentioned about equity, I think is extremely important because it does, pass a strong message. And both Representative Cole and Vice Chair mentioned that actually this is just for women. And absolutely, and I want to make sure that everyone knows that our Chairman Meyer, when I talked to him, the importance to hear this bill, he said, absolutely, we will make time.
I appreciate that.
For the hearing. So I want to applaud to his being sensitive about this issue.
I think he has daughters.
He is.
15 and 13, there you go. Thank you very much. I appreciate that.
Representative Shine, Representative Noble, did you all? You're good? Yeah, very good. Thank you, Representative. You reserve the right to close.
I do, thank you.
Very good, thank you. Chair calls Ashley Arevalo? Revelo? Oh, Revelo, probably. Ashley Arevalo.
Good afternoon, Chairman Meyer, Vice Woman Theory, and Ways and Means Committee members. Thank you so much for the opportunity to provide public testimony. My name is Ashley Arevalo, and I am providing testimony for HB 321, and I'm representing myself. I live in Texas House District 34, which is Robstown, Texas, in Nueces County. I've been an advocate for menstrual equity since 2016, and I have helped co-found the Texas Menstrual Equity Coalition in 2020. In these years, me and my organization, Crimson Cause, has donated over 70,000 menstrual products to the coastal Bend area. We also hosted workshops to teach people about the advantages of using reusable menstrual products, and we have successfully petitioned to get free menstrual products in the restrooms at Texas A&M University Corpus Christi. I have been very fortunate enough to have never experienced period poverty myself, but it has affected my family. In 2017, my grandma passed away. It was at her funeral when I found out that one of the reasons why she dropped out of school in the 8th grade because she didn't have access to menstrual products. After her mom died, she was forced to work in the fields to provide for her siblings, and she also didn't want to experience the shame of bleeding through her clothes at school. This occurred in the 1940s, and this unfortunately still happens today in 2021. The tampon tax is an unnecessary barrier for everyone who needs menstrual products to go to work and school and to live their life to the fullest potential. It makes these products even more expensive to people who cannot afford them in the first place. I believe that getting rid of the sales tax on menstrual products will take Texas in the right direction and helping eliminate the larger issue of period poverty in our great state. We will never truly reach gender equality while we still have a sales tax on products that are absolutely essential to our livelihoods. Once again, I would like to thank you all for the opportunity to provide public testimony, and I strongly urge to vote HB 321 out of committee soon. Thank you.
Very good. Members, any questions? All right. Thank you very much for your testimony. Appreciate it. Chair calls Claire Moore.
Good afternoon, Chairman Meyer, Vice Chairman Thierry, and the Ways and Means Committee members. Thank you for the opportunity to provide public testimony. My name is Claire Moore, and I'm providing testimony for House Bill 321. I'm representing myself. I live in House District 46, which is in Travis County. I've been an advocate for menstrual equity for almost 3 years. In these years, I've worked with my community, my peers, and my school organization, Periods ARS, to help facilitate conversations around period stigma and period poverty at my high school, the M. Richard School for Young Women Leaders, founded by our former governor here in Austin. Through my advocacy work, I've seen just how deep the roots of period stigma and poverty run in our school, even though we are a girls' school and are made up of mostly menstruators. The shame and stigma around period poverty and periods in general, I've seen to be a huge and growing problem among my peers and my classmates. For me, this issue is very personal. While I'm lucky enough to not experience period poverty myself, I've seen firsthand how it affects the daily lives of people in my community. At school, I always bring extra pads and tampons because I know that someone will need them. For many students, lack of access is no longer an if, but a when. They are forced to find a friend or a teacher and fight through the shame and embarrassment that comes with even asking for products. I even know some girls who have been forced to make makeshift pads out of toilet paper because they didn't have any real ones of their own. You could ask any one of my classmates, and they could give you a detailed list of every teacher who carries products, where their classroom is, and what supplies they have. This is because when you live in a culture that is run by period poverty, these are the kind of things you have to know. For these students, having a period wasn't a choice. It wasn't for me, for my friends and classmates, and for those who on a daily basis find themselves without the ability to stay clean and most importantly to stay safe. For these people, menstrual products are not a luxury. Nothing about periods is luxurious. They're a medical necessity, and I believe the state tax code should treat them as such. I would also like to recognize that I do understand that this is a taxation matter and that the budget does come into account. But these things are necessary for women, for trans people who experience periods and menstruation, and this is just the kind of thing that is necessary, and I believe that it should be treated as such. Once again, I would like to thank you for the opportunity to provide public testimony, and I strongly urge you vote HB 321 out of committee soon. Thank you.
Very good. Members, any questions?
I have a question.
Yes, Chair recognizes Representative
I'm
Cole.
proud to have you testify. You're from my district.
Yes, I am one of your constituents. I believe I live in the same neighborhood as you, actually.
Oh, very good, very good. I wish we were testifying about something else other than the fact that we still don't have this necessity. But did you say you go to Ann Richards School?
Yes, I do. I go to the Ann Richards School for Young Women Leaders here in Austin.
And it's an all-woman school, and you have to take feminine products to the Ann Richards School?
Yes.
No further questions.
Thank you, Representative Cole.
Thank you.
Members, any other questions? Thank you, Ms. Moore.
Thank you.
Chair calls Shreya Tama.
Good afternoon, Chairman Meyer, Chairwoman Theory, and members of the Ways and Means Committee. I appreciate your time and the opportunity to provide a public testimony today. My name is Shreya Tama, and I'm providing testimony in favor for HB 321. I'm a resident of Texas House District 115 in North Texas, and today I'm representing myself. It was during the summer of 2019 that I first learned about period poverty. And it's one of the reasons that a few organizers and I from across the state co-founded the Texas Menstrual Equity Coalition in an effort to connect movements combating period poverty through legislative advocacy, fundraising, education, and grassroots organizing. A few weeks ago, during the winter storm that ravaged Texas, I dropped off some water and products at a local warming station and met a woman who, pre-pandemic, would regularly donate supplies in her community, but has now been left on the receiving end. Even in the best climate, menstruators struggle to receive the care they need, but over this past year, school closures, financial strain caused by the pandemic, and environmental disasters have all amplified this lack of access to basic menstrual care. Despite this, our community has learned to depend and rely on each other for aid, given the amount of organizations that are here today that have been working to combat period poverty. But I believe that legislative action is the next step that Texans must take to truly support its citizens. While getting rid of the tax on menstrual products, as everyone here has mentioned today, won't entirely solve the issue of period poverty, it will allow folks to save money and, for example, not be forced to make the decision between buying products or having their next meal. As someone who, throughout her education, has skipped classes due to a lack of products or unbearable cramping, had to create makeshift padding out of items I had on hand, and was for years ashamed to even talk about menstruation and my biological needs, the cause of menstrual equity is extremely close to my heart. I'm truly honored to be standing here in this room today with my fellow incredible organizers. But thank you to the Ways and Means Committee for already showing so much support and co-authoring, as many of you have, and just listening to our stand and giving us the opportunity to speak. I urge you all to vote HB 321 out of committee and take the next step towards ensuring menstrual equity for all.
Very good. Thank you. Members, any questions? No, you're great. Thank you very much. Appreciate your testimony. Chair calls Andrea Elizondo.
Good afternoon, Chairman Meyer, Vice Chairwoman Theory, and committee members. My name is Andrea Ramos. I'm providing testimony for House Bill 321, and I'm representing myself. Thank you for the opportunity to provide public testimony. I am one of the organizers for the Texas Menstrual Equity Coalition, which many of us are here today. And also, I'm involved with Menstrual Flux, which is an organization in Texas that has been mailing free period products to Texans throughout the state since the beginning of the pandemic. I have personally witnessed over the last year an increase of requests for menstrual products due to the pandemic. I have received comments like, "Thank you for providing this service. I would have never been able to afford products while I've been laid off." I have a personal connection to period party myself. I was raised in a single parent household where my budget was very limited. So whenever I noticed that there was very low menstrual products at home, I made a conscious decision to use the very uncomfortable products at school, which puberty itself is already uncomfortable. Adding uncomfortable products to that is very unnecessary. But I would like to say that at least my school had a steady flow of menstrual products. I have received requests from school social workers and school nurses asking for additional products because they can keep up with the demand at their local schools. Eliminating the sales tax, of course, is not going to eliminate period poverty, but it is going to alleviate some of the economic hardship for vulnerable communities. And additionally, none of us chose to menstruate, and we shouldn't be taxed over something that's so natural to us. And this tax is basically a tax on our monthly existence. Once again, I would like to thank you for the opportunity to provide public testimony.
Members, any questions? Very good. Thank you for your testimony. Chair calls Sheena Sutaria.
Good afternoon, Chairman Meyer, Vice Chairwoman Theory, and the Ways and Means Committee members. To begin, I'd like to convey my gratefulness to all of you for giving me this opportunity to give this public testimony on a topic that I've been advocating for many years. My name is Sheena Sutaria, and I'm from Houston, Texas, and I'm here to testify in support of House Bill 321, and I'm here representing myself. I'm also the co-logistics coordinator for the Period PAC, which is an organization in Houston, Texas. We're an organization that has been working to educate our community about period poverty on our socials, and we've also donated over 13,000 products in the past year to schools and shelters that can afford these basic necessities. Along with my work for the Period product, I've worked with a number of other organizations on projects for the homeless, addressing issues such as the lack of feminine hygiene products, medical equipment, and so on. In my most recent project, I've actually received a grant to assist me in obtaining medical supplies for the homeless in downtown Houston. I recognize that I've been very fortunate and privileged to never have to worry about being unable to afford menstrual products every month. However, that's not the case for the dozens of other women that I've encountered personally. I wish these women can be with us to share their stories, but due to conditions, I'm grateful to be able to speak on their behalf. Most of the women I spoke with say they haven't been able to buy menstrual products in over a year. When I ask them how they're able to handle their monthly periods, they say they have to resort to using old clothes, socks, plastic bags, and napkins instead. For months, these women had to function in these conditions, in unsanitary conditions that expose them to pain and infections which they can no longer afford treatment for. I talked to one of the women that lived underneath the highway by the shelter, which I often go to donate products. We had a wonderful conversation when I noticed her limp one day a few months ago. When I asked her if she was injured, she embarrassingly admitted that she was on her period and was actually using a plastic bag around her hip. She used the money that was donated to her to feed herself for the week. This 40-year-old woman, who was a nurse in the past and has said that she's donated many products before, is now on the opposite end, having to use a plastic bag on her period because she had to choose between eating today and affording a simple feminine hygiene product. These women have to lose their privacy to be able to manage their periods freely. They're embarrassed to be unable to conceal when they are on their period and suffer constant infections. I haven't seen that woman in over 2 months. I'm not sure where she is, but I'm glad I'm able to share her story today. These menstrual products are considered as a luxury item, but there's nothing luxury about having your period or having to tie a plastic bag around your waist, when in fact this is a need and necessity for many women. By removing the sales tax, we are one step closer to making menstrual products more affordable to all. Lastly, I hope you remember the stories of these women who are suffering in these inhumane conditions due to the fact they cannot afford these quote-unquote luxury products. I'm so grateful that I'm able to share the voices of the homeless women in Houston, Texas, due to the fact they're not able to physically come here and travel here. I once again want to thank you for allowing me to make my statement today, and I hope you will all support this bill out of committee. Thank you.
Very good. Thank you very much. Members, any questions? All right. Thank you very much for your testimony. Appreciate it. Chair calls Alexa Atkinson.
Thank you for the opportunity to provide public testimony. I'm providing testimony for HB 321, and I'm representing myself. Since I started my nonprofit, I had the opportunity to work with homeless shelters, women and children's shelters, foster homes, schools, and shelters who take in children who have been survivors of sex trafficking. When working with these shelters, I've had the opportunity to hear their stories, and along with their stories, hear the many terrible things that they have faced. One thing people tend to miss is the struggle they face when purchasing menstrual products. The prices are already so high, and the added tax doesn't help. Many students struggle with being able to afford these products, and because of this, have had to make period products out of toilet paper or have had to miss out on their education completely because they had to stay home. The cost is already so high, like I stated, and adding the tax makes it even more impossible for these young students to purchase pads and tampons. We have to ask ourselves, is it fair that people have to miss out on their education because of a period? We all deserve a fair chance and shouldn't be punished for something that we didn't ask for and something that happens to us 5 to 7 days out of every month. In the women and children shelters, I have spoken with women who have came out of extremely horrible situations, and the trauma they have already endured is heartbreaking. They have told me stories about how they had to choose between food and period products because they couldn't afford to purchase them themselves and their kids. As a mother myself, I can't imagine having to make that decision or having to tell my child that mom couldn't afford these products because they were too expensive or had to miss a meal because we had no other option and had to choose between one thing or another. Let's not forget about the families who have multiple people in the house with periods. If a family has 3 menstruators in the house, then that added tax makes a huge difference throughout the year. Yet another story that broke me was speaking to the director of a house who takes in children from ages 6 to 18 who are survivors of sex trafficking. At the time, she had around 50 girls, but they were getting 1 girl every week. She mentioned to me that many people donate products such as clothing and food, but one thing people forgot are about period products. She told me that it is a struggle because they didn't have much funds and purchasing that many period products was costly. In a situation like this, taking off the tax would help out tremendously. These babies have been through so much in life and something that I hope none of us will have to see our kids, grandkids, or anyone we know have to go through. The last thing they should have to worry about is if they will be getting their monthly period products in. The money they could also save could be used for other things to help these brave children grow and recover from the terrible things that they have suffered. Finally, the most recent was people struggling to buy period products during COVID-19. Periods United typically donates to shelters, but during the pandemic, we had an outpour of people reaching out to us for products because they had lost their jobs. The saddest part about all of this was many of these people would send us messages apologizing and telling us how embarrassed they were because they had to ask for help and never thought they would be in this situation. COVID-19 took a hard hit on all of us, but imagine adding a period to that. And the added cost when people were already literally scraping for money because they had lost their jobs. There are already a handful of states that have ended this discriminatory tax, and I feel like Texas should follow. The reasons I have given you are actual stories from people who have been greatly affected by this, and it's our responsibility to make sure we all have a fair chance. Periods are awful, and people shouldn't have to worry about any added costs that make them have to choose between one thing or another. Once again, I would like to thank you for this opportunity to provide public testimony. I strongly urge to vote HB 321 out of committee soon. Thank you.
Very good. Members, any questions? Thank you very much. Chair calls Paula Blackman.
There are 2 registrations for her.
Great to see you, Paula.
Good to see you too, Mr. Chair.
Quick question. There are 2 registrations for you.
I bet somebody did it and then I came and did it.
Very good. Perfect. So we have your permission to delete 1.
Yes, sir, you do.
Very good. Well, it's great to see you, Councilman.
Good to see you too. Good afternoon, and I appreciate this opportunity to speak for HB 321. Chairman Meyer, it's always nice to see you, a fellow Dallasite in Austin, and I appreciate you taking the time to hear testimony on this important issue. And thank you, Vice Chair Theory, for also being here today, and to my other fellow North Texan, Ms. Chin Button, thank you for being here, and to the rest of the committee. My name is Paula Blackman, and I'm a proud East Dallas resident. I'm here today to testify in support of HB 321, and it is time to put an end to this gender tax. I am grateful for the Representative Howard's leadership on this issue and the necessary changes made in this bill, which would exempt feminine hygiene products from any sales tax. It is incredibly encouraging to see bipartisan support and leadership from many members of the Dallas delegation on this bill, which simply highlights how needed this proposed legislation is. It's unreasonable, unconscionable, and inequitable that feminine hygiene products, including tampons and sanitary napkins, are subject to sales taxes. Grocery items such as food and medicine are not subject, nor should these extremely necessary hygiene products be. These are not a luxury item, as the Texas tax code would imply. They are medically necessary every month for decades of women's lives. It is estimated that 1 in 4 women struggle financially to purchase these products. We know that COVID-19 pandemic has increased financial hardships for many in our communities, and we should not be adding to that hardship by taxing products that are needed by women to simply live. The taxes also disproportionately impacts poor women and leaves women experiencing homeless and oftentimes desperate situation during that time of the month. The time has come to repeal this outdated gender tax and stop punishing women financially for having their periods. It is for these reasons that I'm here today before you testifying in support of this bill. However, the work cannot stop here in Austin. That's why I've been working with the City of Dallas to examine implementing a pilot program which would stock women's restrooms in city facilities with pads and tampons. It is my intention that these hygiene products be available to any woman who finds herself in need in a public facility. Should this pilot program prove successful and effective, it would be my hope to expand it into all City of Dallas facilities and to collaborate with Dallas County and Dallas ISD to see if we can make these products accessible in all government facilities throughout Dallas. The work is already being started in Dallas. I'd like to acknowledge the work being done by Tammy Kohlinger and her organization, Take Charge Period. And I'm also proud to have a couple of my own local advocates here today with me. In the summer of 2020, Tylen Moore and Aaron Davis started a chapter of Period, the menstrual movement, at Yvonne Ewell Magnet Center. Period is a youth-run activist group started by Nadia Okamoto, who fights to end period poverty and stigma through advocacy, service, and education. In 2020 alone, through her chapter, she had distributed over 5 million products to menstruators in need. Students like Tylen and Aaron are seeing the need in our community and are stepping up to help women and girls across the country, and we should stand with them and do the same. Like many of you, I draw my inspiration from the youth we see here today and from our communities because it is up to us to leave Texas a better place than we found it. So let's join them in making Texas a better place for Texas women by repealing this senseless gender tax and making feminine products more accessible to any woman in need. Thank you, Mr. Chair.
Very, very good. Members, any questions? Thank you for coming from
Thank
Dallas.
you.
Appreciate it.
Appreciate it.
Chair calls Sophia and Chia. And although your representative is questionable, I do look forward to your testimony.
Well, thank you. I heard that Ty Lin was here. Yeah, we actually go to the same school, and we're both super big into menstrual advocacy, so it's really cool to see her. So yeah, good afternoon, Chairman Meyer, Vice Chair Theory, and members of the Ways and Means Committee. My name is Sofia Ramirez Sanchia, and I am testifying on behalf of myself in favor of HB 321, my bad. Right now, I'm a junior at the School for the Talented and Gifted at Townview, and I have advocated for menstrual equity in Dallas Independent School District. My first encounter with menstrual equity issues was in middle school, where there was already a stigma about the nature of menstruation. From a young age, girls are taught to feel ashamed for experiencing this natural process, coupled with the fact that feminine hygiene products are an expense that not everyone can afford. This issue is more than just taking away a simple tax. This is an intersectionality issue. Nearly 1 in every 5 American teenagers who live in poverty lack menstrual products and support, which may inherently lead to absenteeism and lost educational opportunity. To put this statistic in perspective, 86% of students in Dallas Independent School District are economically disadvantaged. And I didn't put this in my notes, but today I learned that 3,500 students in DISD are homeless. So I can only imagine the disproportionate effect that has on those young female students. I'd also like to make a point that it doesn't only affect women. There are many non-binary or trans folks who don't necessarily identify as female, but still go through the exact same process. And I'd like to acknowledge that. These are students that are being disproportionately affected and are having to pay unnecessary taxes for essential products. The tax itself places a level of privilege over a product that is a necessity to anyone who menstruates. The tax is a burden to low-income individuals, many of them who are of minority backgrounds. Why should half the population face a burden of paying even more for an essential product? We already face the burden of having to buy the product itself, which is an additional expense that half the population doesn't even have to endure. So we ask for just the bare minimum, that we continue to further the burden with taxation. That we don't have to continue the burden, my bad. Already, 20 states have eliminated taxes on these products, so there's a momentum on this issue. And by eliminating this tax, 15 million Texas women, at the minimum, will be able to pay less for an already essential product. Thank you for your time, and I hope you give this bill favorable testimony.
Thank you. Members, any questions? Very good. Thank you very much for your testimony. We appreciate it. Chair calls Aaron Davis.
Good afternoon, Chairman Meyer, Chairwoman Therry, and other members of the committee. My name is Aaron Davis, and I'm here in support of HB 321, and I'm representing myself. I'm here because through my experience with the period and menstrual movement, which I am with Tylen, who's also here, I've learned the extensive seriousness of the situation. Also, in my last school year, I was told by a few girls at my prior school, Amarongo Young Women's Leadership School, DISD, that they would not have been able to attend school had there not been products provided by the nurse. My most recent visit to my new school, Townview Talented and Gifted, I noticed that the lack of menstrual products. For some of the students at this school, kids and their families cannot afford the products, and school is their only support. So imagine their dismay when they go to school and they're not there. At the end of the day, this bill would not only make menstrual products more accessible, but school and work too. Thank you for your time and willingness towards letting me testify.
Very good. Members, any questions? Thank you very much for your testimony. Appreciate it. Sarana Zhang. Chair calls.
Good afternoon, Chairman Meyer, Vice Chairwoman Theory, and the Ways and Means Committee members. Thank you for providing the opportunity for me to speak before you today. My name is Sarana Zhang, and I am providing testimony for HB 321. I am representing myself. I'm a high school student, a junior at the Kinder High School for the Performing and Visual Arts in Houston, and I reside in House District 134. I'm one of the organizers of the Texas Menstrual Equity Coalition, which you've heard from today. And even before becoming involved with Coalition, I founded the Period Pact Houston in 2019, which Sheena mentioned she was a part of. And we are a student-run organization that works to end period poverty. Our team of high school students has collected and donated nearly 22,000 products over the last 2 years that we've been active to various schools, shelters, and other organizations in need. But even that number of products has not been enough. In fact, it has been far from enough, and it's been extremely frustrating for us as an organization to see the level of need within our community. Whenever I make another donation drop-off, driven by my parents because I can't drive myself yet, I talk to nurses and teachers who are unable to supply their students with the period products they need. And I hear this story over and over every time I go to a new school, whether it's an elementary school, a middle school, a high school, all within my own school district. Students cannot afford to bring their own products from home, yet are still met with shortages when they go to school, a space that's supposedly meant for them to learn and feel safe and healthy and protected. This tax, this tampon tax, is simply an additional barrier to allowing these students their education, dignity, and health. Menstruation is not a choice. It's a sentiment you've already heard echoed many times today, but I'd like to say it once again just to reinforce this. We need to stop treating period products as anything but a necessity, especially not at the literal expense of Texas students and menstruators. Our organization is one of many menstrual organizations across the country, even the world, because this is a global issue as well. But just like any other issue that faces our communities, legislative change is the most effective and decisive course of action. People like the advocates gathered before you today, especially the young people gathered before you today, have worked constantly to make sure our peers do not miss out because of their periods. This has been a 24/7 project for me on top of my schoolwork for the last 2 years, and that's why I traveled all the way from Houston with many of my other fellow organizers to talk to you today. And though a few cents and dollars may seem inconsequential, the money quickly adds up, especially for students in underprivileged and impoverished areas. Beyond eliminating the additional financial burden, the elimination of this tax sends an important message. A menstruator's health matters, a menstruator's education matters, and access to a box of tampons or pads should not change that. Once again, I would like to thank you for the opportunity to speak before you today, and I'm grateful to add my personal experience into this. And I strongly urge to vote HB 321 out of committee soon. Thank you.
Very good. Members, any questions?
Yes.
Chair recognizes Chair Button.
Thank you, Mr. Chairman. I just want you to know how proud I am to see you here.
Thank you.
And as the stereotype of Asian American women, usually kind of quiet, not to speak up. And I'm so happy to see you join many other young girls, young women coming here to voice your concern on this equity and very important health issue as well. And especially during this environment, there are so many anti-Asian violence out there. So once again, you came all the way from Houston, and I want you to know that, please tell your parents that they should be very proud of you.
Thank you.
Thank you.
Thank you. I very much appreciate that.
Thank you, members. Any other questions? Thank you very much for your testimony.
Thank you.
Chair calls Esther Matthew.
Good afternoon, Chairman Meyer, Vice Chairwoman Theory, and Ways and Means Committee members. Thank you for the opportunity to provide public testimony. My name is Esther Matthew, and I'm providing testimony for HB 321. I'm representing myself. I live in Texas House District Number 3, which is in Richardson, Texas. I'm a second-year student at the University of Texas at Dallas. I'm the president and founder for the Period Project at UT Dallas, which is a registered student organization at my university. I started this organization on my campus in fall 2020. The summer before that, I interned with a local nonprofit and fundraised to collect over 4,000 menstrual products to distribute to underserved communities during the COVID-19 pandemic. When I brought this initiative to UT Dallas, I shifted the focus to serving my student body through education, advocacy, and service. This past week, our advocacy team directed our very first Tampon Tax Week, where we held virtual events to write letters to legislators and raise awareness for eradicating the tampon tax. College students who became educated about the issue voiced their support for ending the tax. This issue is very important to me and my organization. To serve our student body, my organization works with the Comic Cupboard, our donation-led food pantry. I have witnessed the dire need to make menstrual products more accessible, especially during COVID-19. At UT Dallas, we have donated a total of over 4,000 products these past 2 semesters. The staff at the Comic Cupboard state that period products are some of the first items to go, and donations for menstrual products are constantly requested. From my experience organizing the Period Project, I know that college students truly struggle to buy period products. This is a need we need to address as soon as possible. Eliminating the sales tax on menstrual products isn't going to solve period poverty, but it is going to alleviate some of the hardship for vulnerable communities, such as struggling college students, to afford these products. Eliminating this tax will also help the Period Project to buy more menstrual products to donate to our local community. I witnessed a need and I decided to step up for my community, and it's time for our legislators to do the same. Once again, I would like to thank you for the opportunity to provide public testimony. I strongly urge you all to vote House Bill 321 out of the committee soon. Thank you.
Very good. Members, any questions?
Just a comment.
Yes, Chair Button.
Thank you so much. I'm also a graduate from UTD, and you live next to my district. Everything I said earlier applied to you. I'm just absolutely proud of all the wonderful young girls. Thank you.
Thank you.
Thank you very much. Appreciate it. Chair calls Pratika, and I'm not going to guess on the last name. P-A-R-A-M-A-S-I-V-A-M.
Yep, that's me.
Perfect. And thank you for helping me out on that.
Of course. Okay. Good afternoon, Chairman Meyer, Chairwoman Theory, and the Ways and Means Committee members. Thank you for this opportunity to provide public testimony. My name is Prithika Parmasivam, very long, very hard, but I'm here. And I am providing testimony for House Bill 321. I'm representing myself. I live in Texas House District 52, which is in Austin, Texas, and in Travis County. I'm a co-founder and lead organizer of the Texas Menstrual Equity Coalition, which is a coalition of menstruators and organizers across Texas advocating for menstrual equity issues. I'm also a college student at the University of Texas at Austin. As a college student, I live and I witness how my peers juggle financial, academic, and social stress while maintaining and working at minimum wage jobs in order to pay for university, pay for rent, pay for food, and pay for all the health needs that comes with being a student and being a person. This places an insurmountable stress on students who struggle to access basic health needs and living needs, such as period products. This also places a disproportionate stress on low-income students who are unable to pay for menstrual products, and this can also affect their academic performance and also their career choices. The tax on period products that we're speaking about today makes this even more inaccessible and stressful. Additionally, I've seen that through my work with the Texas Menstrual Equity Coalition and being able to speak with the wonderful organizers, that this issue is in middle schools, it's in high schools, it's even in elementary schools and happening to everyone in the state of Texas. I would also very much like to echo that while this is a women's issue, it is also an issue that can affect other people, such as non-binary folk and trans people. And I do understand that while eliminating this tax may not completely alleviate period poverty. It is going to alleviate so much of the stress for vulnerable communities and make it easier for college students to live their lives as well as for other students as well. Again, I witnessed a need today, and I'm so grateful to be able to be here, being able to speak to you all. It is time for legislators to step up and help Texas in the way that they can. Once again, I would really much like to thank you for the opportunity to speak to you all today and provide public testimony. I strongly urge you to vote House Bill 321 out of committee soon. Again, I would like to echo that this is a bipartisan issue. It is a health issue. It is a medical necessity for so many individuals in Texas and in the nation and in the world. It is now in your hands. I thank you for being able to be here.
Thank you. Members, any questions? Clarify if she's for the bill. And could you just clarify that you are for the bill?
Yes, I am for House Bill 321.
Very good. Thank you. I appreciate it. Chair calls Anastasia Trevino.
Hello. So I think it's already evening, so I'll say good evening. Chairman Meyer, Vice Chairwoman Theory, and Ways and Means Committee members. Thank you for the opportunity to provide testimony. My name is Anastasia, and I am providing testimony for House Bill 321. I'm here representing myself. I live in Texas House District 32, which is in Nueces County, Corpus Christi. So I have been an advocate for menstrual equity since 2017, and I have worked with Ashley Revelo, who spoke earlier, in our organization called Crimson Cause, to create awareness of this issue and make an impact in our community. During this time, we've helped coordinate and distribute menstrual products through drives to give back to local food banks and homeless shelters. We have delivered products to those burdened by Hurricane Harvey and advocated for public institutions to keep menstrual products stocked in their bathrooms. Through my community work, I've witnessed an excessive need for these products. Menstrual products are often inaccessible, either because people don't feel comfortable talking about the products and periods in general, or just because they are not aware of the need amongst our most vulnerable citizens. I was a middle school teacher for about 5 years, and I had many students personally thank me for having free and accessible menstrual products in the classroom. It saved them a lot of embarrassment of having to go, they have to come and ask to go to the nurse, get a pass, take time to go to the nurse, and then it was actually a cost of like 30 cents to buy the actual tampons and or pads. And having them there saved them crucial class time to just go to the restroom and come back. And I made sure to let all my students know that I had them available if they ever needed any, because I didn't want them to be missing out on education that they could be having instead of wasting time going to the nurse and waiting. So I did my best to make menstruation less stigmatized and more acceptable, so my students wouldn't feel ashamed, and just to remember that it's a natural process and experience that you have with your body. We didn't choose to be menstruators, so we should not be forced to pay an additional tax to just be hygienically safe every month. And menstrual products are a medical necessity, not a luxury, and it should be treated as such in the tax code. So I'd like to thank you all for the opportunity to be here and speak in front of you, and I hope that we can get this bill out of committee soon.
Very good. Thank you very much. Members, any questions? Thank you for your testimony. Appreciate it. Chair calls Andrea Ramos.
Good afternoon, Chairman Meyer, Vicewoman Theory, and Ways and Means Committee members. Thank you for the opportunity to provide public testimony. My name is Andrea Ramos, and I am providing testimony in favor of House Bill 321.
I live in Harlingen, Texas, which is a part of the Texas House District 35. And I would also like to thank my parents who made the expense of driving 5 hours so that I could be here today. I'm a Girl Scout ambassador with the Girl Scouts of Greater South Texas, and I have been with the Girl Scouts for 12 years. I love serving my community through this organization. And for my Girl Scout Gold Award, I've been working to address period poverty in the Rio Grande Valley by coordinating drives for feminine products and increasing awareness of this issue through workshops and creating educational resources. And I've also encouraged Girl Scout alumni and current Girl Scouts to advocate for this bill by contacting the representatives. This issue is extremely important to me because I have seen firsthand how it has affected my own peers. In Texas, 1 in 5 teens has missed class due to a lack of menstrual supplies. In the Rio Grande Valley specifically, 86% of residents are economically disadvantaged. I don't believe any girl or any student should miss out on their education because of a natural bodily function, or that economic status should hinder girls' ability to excel. Feminine hygiene products are not luxuries. They are medical necessities that allow women and girls to participate in community life, education, and employment. Making menstrual products tax-free will not eliminate the period poverty issue, as mentioned before, but is a crucial first step to making these products more accessible to those who need them. I also want to give a lot of credit to my colleagues from the Texas Menstrual Equity Coalition who have only further inspired me to take action against this issue. Once again, thank you for the opportunity to provide public testimony, and I strongly urge you to vote House Bill 321 out of committee soon.
Members, any questions? Thank you, and thank you for driving 5 hours to come here and testify. That says a lot. Chair calls Alice Gray.
Okay. Good afternoon, Chairman Meyer, Vice Chairman Theory, and Ways and Means Committee members. Thank you again for allowing me to provide public testimony today. My name is Alice Gray, and I am representing myself as a resident of House District 49, which is in Travis County here in Austin. So I originally got involved with the fight for menstrual equity 2 years ago as I was volunteering to support people experiencing homelessness in my community. And although we were addressing common needs of food insecurity, it was impossible to ignore the outstanding demand for menstrual products. Having never directly experienced period poverty, this issue really stood out to me, and particularly its ability to hide in plain sight. I can recall far too many negative conversations regarding menstruation throughout my life. And for example, like being reminded that we weren't allowed to skip school just because we were on our period, or being lectured on how we can't just let cramps or heavy bleeding interrupt our education. But these conversations completely fail to recognize and acknowledge the direct connection to period poverty. I'm also a student at the Amherst School for Young Women Leaders, and in my public all-girls school, where 70% of the students come from low-income backgrounds, period poverty is a very real issue. And it's an issue that greatly impacts school absenteeism, affecting female students at disproportionate rates. In fact, according to a study completed by Thanks and Period Inc. in 2018, 84% of students in the US have either missed class time or know of someone who has missed class time because they didn't have access to period products. And that is a really shocking statistic and just highlights how big this issue is. And this issue is a seemingly invisible and ignored issue, allowing low-income, especially menstruators of color, to suffer in silence every month. Some may disagree, saying that menstrual products shouldn't be tax exempt because necessities such as toilet paper and soap aren't, or some products can be. What was the last time a student missed school because they didn't have access to soap? When people are putting themselves at risk of serious illnesses such as toxic shock syndrome, it's time we reassess the situation. And if that's not convincing enough, it's unavoidable to recognize that fully unnecessary products such as desserts you can eat with a fork and yachts are tax exempt in the state of Texas. As a junior in high school, everyone keeps telling me that I'm living through the most important semester of my public school experience. And after taking the SAT last Tuesday and preparing for countless exams over the next month, that statement is becoming very real. I can't afford to be missing school right now, but I can't let this legislation die either because I'm aware of the potential impact that this legislation can have on our communities. So again, thank you so much for your time today and all of your support on this legislation so far. We really appreciate your response to our advocacy and having us all here today and listening to us so attentively.
but I really urge you to support HB 321 and vote it out of committee so that we can hopefully progress it through through the legislative process more. Thank you so much.
Did a great job. Members, any questions?
I had a question.
Okay.
Chair recognizes Vice Chair Theory.
Thank you, Chairman. I wanted to say, I was just thinking while you were speaking, really while all the wonderful young ladies were speaking, I was just thinking about all the grown women, and I was like, wow, there's so many, young, smart, young future leaders here. And I was thinking about, well, maybe we should have some, grown women here to testify. It might be more persuasive. Cat's out the bag. I'm also a joint author on the bill. But, I just realized that you all are us. You are us. We were you. And I just want to thank you, young ladies, because you're speaking on something that probably all the adults should be advocating for more aggressively. And so I think it's important that we think about that in the legislature. You are making a difference. And I just see in every single young lady here, I see a part of myself. And as Chairwoman Button speaking to the lady, young girl talking about, how proud she was of her from a cultural standpoint, I see myself in all of you. And I want to commend you young ladies for what you're doing. One point I'd like to make too to everyone, I hope it's not lost, the bigger issue. I don't think you have to really be poor for us to care about this. I understand that is, an issue that you all are working on. It's very important, but you don't have to really live in poverty for us to see this from a tax policy perspective. I think what this really stems on is this touches girls and women across the board, and they are paying a tax for something that they have no control over. And we look at medical products like even Rogaine, which is many states not taxed. And so I think we're trying to balance that. And so I would encourage anyone listening and all of my colleagues to really think about that as we move forward, contemplating the bill, that we look at the balancing aspect of it, that we're really trying to make good, sound tax policy. And we certainly want to help people that can't afford the products, but even for girls and women that can, it's still, there's an equity there because the products are expensive to begin with, and then you're paying another tax. And so I just wanted to say that too, and just commend all of you young ladies because you are our future.
Well, thank you so much. We all really appreciate that, especially after some people driving 7 hours to get here and spending all the day waiting. Many of us never having testified before and not really know what we're doing, but we care about this. So we
Well, thank you.
came out.
And, I think it invigorates us. Many of us, I drove today and not as far as you, but I shared with Chairman Murphy that I was so sleepy this morning because I left at 5 instead of last night, that I pulled over and I took my duffel bag. I pulled over at a truck stop actually, and I put a beach towel on it and I put my head down for 15 minutes because my eyes were so heavy and I didn't want to have an accident. So I think it's another way to remind us why we make the sacrifice that we do when we see young ladies like yourself testifying. So you just encouraged me all the more.
Well, thank you so much.
All right, thank you very much for your testimony. We appreciate it.
Of course.
Chair calls Zoe Cass.
Good evening, Chairman Meyer, Vice Chairwoman Theory, and Ways and Means Committee members. My name is Zoe Cass, and I am representing myself. I'm also the Advocacy Director of the Period Pact Houston, and I'm one of the founders and organizers of the Texas Menstrual Equity Coalition. I'm here to urge you to vote in favor of HB 321. I strongly believe that the tax on menstrual products is an unfair one. As a menstruator myself, I understand the annoyance and inconvenience that come with having a period. I cannot, however, understand the emotional and financial stress that those experiencing period poverty face. As part of the Period Pact Houston, I have witnessed the immense need for menstrual products in our public schools, including my own in Houston. Every time I buy pads in bulk for a donation, I see that 8.25% sales tax, and I think to myself, couldn't we donate more? Couldn't we do more for these schools if we weren't being charged for the sales tax? And the answer is that yes, we could. When we're buying donations on such a big scale, every 6 cents, which is how much we pay in bulk for a pad, it really counts. So by getting rid of this tax, you're allowing us to buy like 10, 15 more products that can really change a student's day or a whole student's, menstrual cycle for a month. So the donations that we provide to these school nurses, including elementary schoolers, are meant to make a day with a period, a day in the classroom, and not one spent stuck at home. The extra money that these students would save without the tampon tax could be what makes that difference for them. However, it is up to you to make that difference possible. I can't imagine what it must be like to work on a minimum wage job and spend over an hour's wage on a single box of menstrual products. But I can imagine the significant difference that eliminating the tampon tax will have on all menstruators in our state. Eliminating this tax might seem trivial to some or simply symbolic to others. However, for those who miss class because they can't afford period supplies, those school nurses who have to spend their own money so there can be menstrual products in their schools, and for all the Texans who find themselves deciding between a meal and a box of pads, eliminating the tampon tax matters. By finally passing HB 321 out of committee, you'll be taking a monumental step in fighting period poverty in our state. And I'd also like to add that the point made about wound care, technically, if you're looking at the tax code that way, there is a consideration that there's an issue in the tax code and that menstrual products are actually considered wound care under that, so they should already be tax exempt if for nothing else for that reason. So I'd like to thank you for letting me speak to you today, and I'm very grateful that I had this chance to make the trip here and talk with you all.
Very good. Thank you. Members, any questions? All right. Thank you for your testimony. Chair calls Thylan Moore.
Thank you, Chairman Meyer, Vice Chair Theory. My name is Tylen Moore.
You're the Tylen they've been talking about.
I
should
am
have
the
gotten that
Tylen
right.
we've been talking about. Oh, it's fine. There's an H in there that shouldn't be. So.
Well, welcome to our time.
Hi. I'm here to testify for HB 321, and I would like to thank Representative Howard for filing this important piece of legislation. I am currently a sophomore at Townview Magnets School for the Talented and Gifted, along with Sophia and Aaron, where I have founded and am presiding over our chapter of Period the Minstrel Movement, which the organization as a whole has actually donated through their many, many global chapters over 5 million products in 2020 alone, as Paula Blackman stated. I was inspired to start this chapter by the vastness of period poverty and period stigma everywhere, and by Paula Blackman, who I've already mentioned. And she told me, or taught me, what it is to be a woman igniting change in her community, because it's kind of hard to see that every once in a while. So I'm here for HB 321 because nearly every woman has her period for about 40 years, and by the end of those years, she can have paid thousands of dollars on period products alone. Thousands of dollars that no cisgender man will ever have to pay. And it's not an escapable cost, for, as has been stated multiple times, the menstruator cannot choose not to menstruate. It is a necessity born of human anatomy, and as says all preceding removals of taxes, you don't tax necessities. And I know that this will come down to money, and it's money that the state is no longer collecting, but I beseech you to look at it not as a loss, but as a gain for the Texans who you're representing. So I thank you for your time, and I'm happy to answer any questions.
Thank you, Ms. Moore. Members, any questions? All right. Thank you for your testimony. I'm traveling here from Dallas. Chair calls Nitya Bakala.
Good afternoon, Chairman Mayer, Vice Chairman Theory, and Ways and Means Committee members. Thank you for the opportunity to provide public testimony. My name is Nitya Pakla, and I'm a sophomore at the Dallas Math and Science Academy in Houston, Texas. I'm providing testimony for HB 321 I'm representing myself, and I live in Texas House District 27, which is Fort Bend County. Over the past year, I have become heavily involved with fighting for menstrual equity and ending period poverty. I have seen firsthand the financial burden borne by low-income women due to the high cost of menstrual products. The additional tax placed on these products is an injustice and adds an extra burden for these women. Around 2 to 3 years ago, I learned of this unique kind of poverty placed on women, period poverty. And I had naively assumed that period poverty was a problem for the poorer, underdeveloped nations, somewhere out there far away. But what surprised me the most was that period poverty exists here in the greatest nation of all, and not somewhere out in some of the other 50 states, but right here in our own dear Lone Star State, and that too in Fort Bend County. Wouldn't you agree that it is a shame that poor women still cannot afford to buy menstrual products in one of the most affluent counties in our country? This is a real problem. Let me tell you a story. As a director of the Period Pact in Houston, we recently had a menstrual product drive and collected over 20,000 menstrual products. I personally thought this would be more than enough to supply them to the poorer students attending the Title I schools in Fort Bend and Harris counties, and the women at the homeless shelters as well. Well, imagine my surprise when we went to distribute those 20,000 products and had barely enough to supply the students in just half of the schools. There were so many more girls who needed help with menstrual products than we had anticipated. Our founding fathers would be ashamed that their sisters and daughters are having to choose between putting bread on their table and putting period products in their bathroom. It is an injustice to consider it a luxury and place a tax on menstrual products when menstruating is merely a biological need for all women. You have a chance to make history today and abolish the sales tax on all menstrual products. Thank you for your time.
Very good. Members, any questions? Thank you again for your testimony. Chair calls Kira Hopkins.
Good evening, Chairman Meyer, Vice Chairwoman Theory, and committee members. My name is Kiara Hopkins. I am a 16-year-old proud native Texan, and I'm here today to speak in my unyielding support for HB 321, co-sponsored by my District 48 Representative, Ms. Donna Howard. I'm here to speak on behalf of myself as a woman, but also to hold the light of righteousness due to this issue on behalf of all Texans, regardless of biology, as the ongoing taxation of an essential good, menstruational products affects every one of us. Roughly when 10 million Texans depend on it to fully participate in our schooling, economy, and civil discourse. I'm aware that you've already set aside a tax-free period next week for the possibility of emergencies created by a hurricane. While you have yet to address the sexist structure placed on taxes on women because of their menstrual cycle, a flood formed from our bodies that will shed monthly so that we may give life. Can I ask, what is more essential than that? Your support of this bill is a litmus test for each of you here today. Do you embrace liberty? Do you believe women should be allowed to participate fully in our state without an undue burden of this sexist and repressive tax? Do you support working class families and Texan women who have been pounded by this pandemic because of their economic vulnerabilities? Passage of this bill to the full House by this committee will send a message to women and the world where you guys stand on these issues. As a daughter of two educators, I see how the constant need to struggle and choose where our money goes gets very discouraging. But I will not be defeated. Texans depend on this. Women depend on this. Civil discourse depend on this. I thank this committee for your time, and I look forward to seeing the HB 321 deviated on House floor this session. Have a beautiful day.
Very good. Thank you. Members, any questions? Very good. Thank you for your testimony. Chair calls Nora Vigor.
Chairman Meyer, Vice Chairwoman Theory, and committee members, thank you for this opportunity to testify in favor for this bill today. My name is Nora Vigor, and I'm also a woman who bleeds monthly for a solid week, just like your mothers did, your daughters and sisters too. And it is the life experience of half of your constituents. HB 321 lays before this committee now an opportunity for you to correct not only a wrong, but dismantle a part of structures that have impinged on women for far too long. I believe there is a clear and compelling case for the relief of an unnecessary income stream for the state on the wombs and wallets of Texan women and their families. I also trust in the brains and talent of this Ways and Means Committee to figure out the perceived impact on our budget, while the reality is the ending of this tax will serve to stimulate our economy and uplift all Texans. Menstrual products are by no means a luxury item. They are a medical necessity that women and AFAB people, meaning those who are assigned female at birth, don't always have access to. The taxation on menstrual products makes these already pricey items even more unattainable on the Texas minimum wage. This issue is known as period poverty, and one of you said that, this only affects women, but this isn't necessarily true. It affects people of all genders who are assigned female at birth, and it's arguably even scarier for people who don't identify as women, because leaking on your period would out you to all of your peers, anyone who sees, anybody who talks about it, and anybody who overhears it being talked about. And because of those reasons, it's draining on a person's mental well-being, but also stand in the way of a young Texan's education. And to be so bold, the future of Texas politics and power depend on this. I, like a sea of engaged and active young Texans, won't sit by. We are active and mobilized. I will be voting in 2 years, but I'm not waiting till then because this tax affects me and all of my peers. We are all watching whether you take the right action, passage of HB 321 to the full House of Representatives now. I promise we will respond in turn, supporting those who stand on behalf of liberty and equity and dismantling the structures that stand in our way. Thank you so much for this opportunity for my voice to be heard, and I wish you all a wonderful day.
Thank you very much. Members, any questions? Thank you. Chair calls Ryan Sunison.
Chairman Meyer and members of this committee, thank you for your time and attention on this bill. My name is Ryan Sunnison. I'm representing myself and in favor of House Bill 321. I'm a husband, father of 2 young girls, and a finance executive at a tech company here in town, and also a board chair of the Austin Diaper Bank. But I come to you today as a person of privilege. I grew up in the middle class. My parents never had to worry about where the next meal was coming from, or whether we could pay the water and gas bills, or whether they would be employed next month. And because they didn't have to worry about those things, neither did I. It wasn't until I got involved with the diaper bank that I really saw what poverty looks like in our community. Right now, more than 20% of all Texan children live below the poverty line. Nearly 4.3 million Texans are food insecure. 1 in 5 students will miss class any given month because they lack access to period supplies. We all know that poverty is a problem, a big problem, and one that's not going to be solved by House Bill 321 alone. What 321 does do is that it makes a dent. It makes it a little more affordable for people to get those necessary healthcare products. It'll also make it a little less likely that students will miss class because they can't afford these products. But the bottom line is that this bill will help. And the more little dents like this we can make, the better the likelihood that we break cycles of poverty here in Texas. Please support House Bill 321 as written and help our fellow Texan neighbors on making these critical healthcare products more affordable. Thank you.
Very good. Thank you. Members, any questions? Thank you for your testimony, sir. Appreciate it. Chair calls Emily Gatlin.
Hello. Grown woman here, Vice Chair Derry. Not to discount all the young ladies here today. Good afternoon, Chairman Meyer and committee members. My name is Emily Gatlin, and I am here to testify in support of Texas House Bill 321. I serve as the Education Director of Flow Code, a nonprofit organization that has been fighting period poverty since 2017. To further describe the need that's been already mentioned earlier, we distributed over 500,000 menstrual products across the state since our start, and we continuously strive to educate, bring awareness to, and end the stigma of menstruation in our society. Since COVID-19, we've donated 62,000 menstrual products to the city of Austin to aid those in need, because we understand periods don't stop because of a pandemic. We are partners with communities and schools and donate to over 90 Title I schools in Central Texas. Flow Code is the leading support organization in Texas, providing free access of menstrual products to nonprofits, shelters, schools, and natural disaster victims. Period poverty is not only the lack of access to menstrual products, but also reproductive health education, bathrooms, and clean water. It's a global issue that people work to address in other countries, but often isn't adequately addressed in our own society. We do not choose the conditions that come with menstrual cycles, and yet we have to manage our periods the best way we know how. It's a very shared experience among those in low-income communities, the most vulnerable among us, the homeless, BIPOC populations, independent college students, the trans community, and low-income families who have experienced hardships. Those are just some of the examples. I grew up here in Texas. My mother was a college-educated single mom. She had a professional job. We would probably have been considered middle class. But there were often times when there just was not money left over for her to buy period products for her teenage daughters. So that's what happens to those unable to easily afford these products. Passing this legislation will help ease the burden of Texans who are already struggling to have additional funds in their pockets. Additionally, I'm proud to be here and be a part of the growing group of those that are calling out unfair and discriminatory laws, such as the tampon tax. As of last year, the IRS officially designated period products as medical necessities for purposes of flexible spending accounts for those of us who are fortunate to have those. They are tax exempt when you can purchase them with those accounts. I encourage you to follow their lead and support this legislation to end the antiquated and unfair practice of taxing people with periods. Thank you.
Very good. Thank you. Members, any questions? Appreciate it. Thank you, ma'am.
Okay.
Chair calls Holly McDaniel.
Hi, Chairman and committee members. Thank you for having me today. I'm short. Okay. My name is Holly McDaniel. I am the Executive Director of the Austin Diaper Bank. You've heard a little bit from my board chair, a little bit about what we do, but we have a period supply program, which is called the Bright Spot Program. And we give period supplies to low-income families and families living in poverty. But I had a whole speech planned, and I'm not going to do it because you guys heard a lot of amazing things from these young women today. But I want to be the older woman who talks about the data. So there is something that we have learned from the families that we serve at the Austin Diaper Bank. 40% of the individuals that we serve with period supplies actually only need period supplies from us for the last 2 days of their period. They can actually afford enough period supplies to get through 5, maybe even 6 days. It's that last little bit that they have trouble affording. And so those are the families that we serve, that 47%. So if you remove the tax, they can actually go ahead and afford their period supplies for the entire time, right? We're talking 6 or 8 more pads, maybe 10. So it actually does make a direct impact on the families that we serve. The families we're talking about in period poverty, extreme period poverty, you leave those up to me. You leave this up to these amazing young women who are gonna help all of these families. That's our job. This bill will actually help those families that are so close, right? They're living on that edge. They're just teetering on the edge. And if we can just help them a little bit to move them over the edge on the right side, which is what this bill will do, then, it just speaks volumes to the community and to the families that we serve and the families of Texas. So thank you. I am in favor of this bill. I hope you will move this bill out of committee and that it will pass.
Very good. Thank you. Members, any questions? Thank you. Appreciate it.
Thanks.
Chair calls Brianna Sowers.
Good evening, Chairman Meyer, Vice Chairwoman Therry, and Ways and Committee Means members. My name is Bree Sowers. I am an intern and am representing the National Association of Social Workers Texas chapter in support of House Bill 321. So as I mentioned, I am a graduate intern. I attend the University of Texas at Austin. Hook 'em. I'm sorry if that offends anybody. But my main full-time responsibility is as a domestic violence advocate at Safe Alliance here in Austin, the local domestic violence program dedicated to stopping abuse for survivors of domestic violence, sexual assault, stalking, and human trafficking. So I work particularly at SAFE's emergency family shelter, and I have witnessed the crucial need for menstrual products, which are typically overlooked because people have a really hard time understanding why objects that are so necessary and so crucial for women every single month are so inaccessible to certain groups. Working at a family shelter, survivors often come into shelter with little to no items, no clothing, rarely food, sometimes no shoes, and definitely no menstrual products to no fault of their own. I will actually never forget the time, and this happens way more often than you would think, that we had a survivor that was brought in by APD right off the streets, and she came to me in tears because she had just started her period. She had a couple bucks to her name, but she didn't quite have the right amount to go purchase an off-brand Equate box of tampons at the Dollar General. She came to me extremely embarrassed, as she feels that she should have been, and in tears, and it broke my heart. And I hear these stories on a daily basis because I work at the family violence shelter every single day. And don't get me wrong, our survivors are resilient people. They come to us from all walks of life. They are by far the strongest people I have ever had the pleasure of working with. But it's often those really little inconvenient things that break even the strongest people. And I can guarantee you that this common, frustrating, and exhausting reality of not being able to afford a box of tampons affects all of our survivors, affects so many people in this room, and has definitely affected me. Personally, and I might be able to speak for every single person who has had a period, we do not choose to go through menstruation, and we shouldn't be expected and forced to pay this tax. So I am urging you to vote this bill out of committee. Thank you so much.
Thank you. Members, any questions? All right, thank you for your testimony.
Thank you.
Chair calls Laura Habib.
Good evening, members. Laura Habib, Texas Controller of Public Accounts.
Very good. Thank you for being here. Earlier on and during the bill layout, Representative Howard had an exchange with Representative Cole about different medical products that were exempt. Can you give us a little, and Vice Chair Theory, I think, did an excellent job of kind of enlightening us to a certain extent, but can you give us a broader scope of what is currently exempted in that realm?
So statutorily, right now, what's exempt are drugs or medicines that are either prescribed by a doctor or those that are not prescribed but have a drug fact panel on the back of them. So they're specific to drugs or medicines, and the code includes other things as hyper needles, devices used on the body, and things like that.
Medical necessary.
Medical
products.
items that the statute lays out.
Okay, very good. Members, any other questions? All right, thank you for your testimony.
Thank you.
Is there anyone else who wishes to testify on, for, or against House Bill 321? All right, if not, the chair recognizes Representative Howard to close on House Bill 321. And before you do, I just would like to make the note as well, as although Ways and Means, we've seen many very good witnesses, and no offense to Dale Kramer, but by far the most impressive advocates that I've seen on an issue this session, and I probably think I speak for the committee as well. So thank you for everyone for being here. Chair recognizes Representative Howard to close.
Thank you, Chairman Meyer, for those comments. I too am very impressed with not only the young women, especially impressed with them, but also the more adult people who also came and testified. I appreciate all of that. I do want to clarify one thing about the exemption too, in addition to what the representative from the Comptroller's office said. Though the wording is wound, which I would not suggest this is necessarily classified as, the exemption is for wound care dressings that are applied directly to or inside a wound to absorb wound drainage and to protect healing tissue, et cetera, et cetera. There are those that would believe that this could actually apply depending on how you want to parse the word wound. Mention that. I also want to say to Representative Murphy, sorry, Representative Murphy, that's always a cheap shot about the baked goods with the fork. You know, that's just something from the past. And you did not have a fiscal note, I believe, on that one. But that was the only piece of Ways and Means legislation that passed that particular session. So it's always there for us to talk about. I think it's important to hear all of the folks that are talking about the contributions and donations that they make. And if they're not a 501c3, then they're making those by buying these items and paying a sales tax and donating them to get the greater good to distribute to these folks. So certainly not having the sales tax would also help those who are generous enough to be trying to help others as well. And I'm very intrigued by the fact that the flexible spending accounts do not consider these to be taxable items. I think that's an important thing to think about too. Bottom line, as Representative Theory said, this is not just about those that are affected by period poverty. That is absolutely an important issue here. But this is something that I would suggest from some of the testimony you heard too, that is reflective of a gender tax. It is something that we have no control over, we have no choice about, and yet we have to pay this tax. It just seems, in all fairness, that this should be one of those things that you look at and say, you know, this is something that we are going to ensure that half of the population of this state does not have to pay simply because they're a woman, simply because biologically this is something that occurs to them every month and that they have to buy this product. So, I mean, I don't know how, I can't say any more than what you heard. And I appreciate your attentiveness to all the folks that came, especially the young women who came from a distance to participate in their government and to find something that means enough to them that they were willing to do that and to take the time to come here, I think speaks volumes. And I will just leave it to what they said for you to think about those things. And I will hopefully you will give this your favorable consideration, despite the fiscal note, which we can work on. I mean, I'm on appropriations. I'll work with you guys on it, okay? But thank you so much for the time you've given us today. And yes, if there's any more questions, I'd be happy to answer them. Otherwise, I can close.
Very good. The chair recognizes Vice Chair Theory.
Thank you, Mr. Chairman. A question and a comment. First, the comment, I commend you for bringing this legislation. I think from what I hear, you've brought it many, many times. I don't know that I would have had the guts, so to say. I think it's something that a lot of women think about doing, or once you've highlighted it, but it's something that we just have come to accept. That's the way that it is. And so it's awkward. It's an awkward conversation, I feel, just if you feel the air in here. But once again, I encourage everyone listening and thinking about this that we go back to just maybe how this started. And I was wondering, you know, when you first started filing this legislation, have you ever been able to pass the bill out of committee, or has it always just been more of a fiscal conversation, or has the conversation ever steered more just towards the fact that that's just the way it is?
Well, last session was the first time we actually had a hearing. So it has not passed out of committee yet. That was our first time to do it. It had the bill, as have many others of our colleagues, both Republicans and Democrats have filed this legislation for several sessions now. I'll have to say, Representative Theory, that like what you've just suggested, this was not on my radar. It came to my attention, I want to say probably about 8 years ago. Read about it, heard about it from constituents, heard about it from young people in particular, and heard about it from these wonderful people at the diaper bank who also provide these period products. Heard about it from the local school district and how they were providing these products so that girls could stay in school, in the classroom, and the discriminatory impact on education for girls. Boys may be absent for something else here or there, right. But girls regularly oftentimes are absent for a couple of days every single month if they don't have these supplies. So it raised my consciousness.
And I wanted to ask you this too. Is there any, without your bill changing in a substitute and making sure it stays germane, has there been any thought with clarifying the actual I think the comptroller talked about the statutory definitions so that it could be maybe codified as what the product is for? Because I know, I wish we'd had some resource witnesses that were doctors, because I'm very familiar with certain medical conditions that cause women to bleed throughout the month beyond when they're menstruating, just like endometriosis and other things where it's just constant unless they take medication.
True.
And they would have to use more of these products.
That's true.
Than just the time of the month where it's their cycle.
Absolutely.
There are a lot of conditions that do that. So I was wondering, or is that not even a necessary fix? Does it not have to be codified or classified as a definition? Because I don't know.
I can't answer that exactly, but from my understanding, it does not need to be. My understanding is that this would satisfy what we need to do in terms of adding this to the list, despite what the other things are that are on the list. It would just be one more thing added to the list.
Okay, thank you very much.
You're welcome.
Very good. Members, any other questions?
I have a comment.
Yes, the chair recognizes Representative Cole.
I want to commend you on bringing this bill and all the young women who came to travel so far to testify, and I'm proud to be a joint author.
Thank you. I'm proud to have you as a joint author. Appreciate it.
Thank you. Members, anything else? All right, thank you, Representative Howard.
Thank you so much. I close.
If there's no objection, House Bill 321 will be left pending. Is there objection? Chair hears none. House Bill 321 is left pending.